Hi, my name is Tracy Sapita. I'm a student physical therapist assistant with Jeff State. Thank you for joining me for my micro teach on acid-base imbalances. Today I'm going to talk about two different types, metabolic alkalosis and metabolic acidosis. The normal blood pH ranges from 7.35 to 7.45, and it represents the amount of hydrogen ions in the blood. When there is a decrease in hydrogen ions, it is an alkaline state, and this shows as an increase in pH. This is known as metabolic alkalosis. With metabolic alkalosis, there's either a loss of acid or an increase of bicarbonate. When there's a decrease in hydrogen ions in the extracellular fluid, the hydrogens move out of the cells and into the extracellular fluid, and the potassium in the extracellular fluid moves into the cells. As hydrogen decreases, calcium ionization decreases, and nerve cells allow the sodium to move into the cells, and this triggers neural impulses in the PNS and CNS. This results from excessive diarrhea, laxatives, diuretics, antacids, milk, vomiting, bulimia, severe hyperactivity of the adrenal glands, nasogastric suctioning, blood transfusions, steroids, and decrease of potassium with diuretic therapy. Manifestations of metabolic alkalosis include agitation, irritability, hypoventilation, nausea, vomiting, diarrhea, lack of emotion, confusion, restlessness, stupor, muscle twitching, cramping or weakness, violent muscle spasms, or rigidity. Patients may also experience seizures, dysrhythmias, paresthesia, respiratory paralysis, or a coma. And they can have a deficiency of chloride or potassium. Metabolic acidosis is an increase of hydrogen ions. This is an acidic state, which is a decrease in the pH of blood. It is either an acid buildup or a loss of bicarbonate. When there's an increase of hydrogen ions in the extracellular fluid, the extra hydrogens will move into the cell, and potassium moves out of the cell. This changes the balance of potassium, sodium, and calcium, and neural excitability is then impaired. This results from when the kidneys fail to excrete acids, from severe dehydration, diarrhea, shock, seizures, uremia, alcoholism, lactic acidosis, ketoacidosis, starvation, or ingesting toxins and acids such as salicylates. Methanol, you will have visual changes, and ethylene glycol, there's tinnitus and vertigo. Manifestations of metabolic acidosis include hyperventilation, nausea, vomiting, diarrhea, headache, malaise, muscle weakness, neuromuscular hyperexcitability, muscle twitching, and increases in potassium. It may also cause myocardial depression, hypotension, stupor, unconsciousness, coma, and even death. Chronic metabolic acidosis can result from a decline in acid excretion, which can lead to kidney stones, loss of bone density, and muscle wasting. We need to monitor patients who are at risk. Diabetic ketoacidosis can be seen if the patient has a breath with a fruity odor. Hyperglycemia can result in severe dehydration, and this can be detected with a decrease in blood pressure and an increase in heart rate. Metabolic alkalosis, the patient will have shallow, slow respirations in order for the body to try to compensate. A decrease in calcium can be seen when muscle spasms are in the hand when blood pressure is monitored. We need to also protect the patient if they are having involuntary muscle contractions. Diagnosis is done with a blood gas analysis. In order to treat, they must determine and correct the cause. They need to monitor fluid balance, potassium levels, arterial blood gases, and oxygen saturation. In severe cases of metabolic alkalosis, potassium chloride can be given via IV. And in severe cases of metabolic acidosis, sodium bicarbonate can also be given via IV. If the patient is in renal failure, they need to undergo dialysis. The prognosis of this depends on the cause. Elderly are at an increased risk due to changes with age. The alterations in functions of the kidneys and hormones decrease the body's ability to maintain homeostasis. Some impairments we may see in patients include muscle weakness and atrophy, a decrease in endurance, impaired balance, impaired postural stability, decreased aerobic capacity, and abnormal tone. Functional limitations they may have due to these impairments are sitting and standing intolerance, a difficulty moving around in their environment, a difficulty ascending and descending stairs, and difficulties getting in and out of the bed. The disabilities include limitations with self-care, home management, recreational and leisure activities, and mobility in the home and community. The musculoskeletal practice pattern 4C, impaired muscle performance, helps to direct physical therapy. The focus is on increasing strength, increasing power, endurance training and reconditioning, and increasing aerobic capacity. Physical therapy should begin at a low level and progress based on the patient. In conclusion, acid-base imbalances can be detrimental. Physical therapy should be aware of early signs and monitor the vitals of patients at risk. The underlying cause needs to be determined and treated quickly.